Welcome to At Home and Abroad with Harrison Walker. Join us each week as we follow our curiosity, diving deep into the familiar and the foreign. Reach beyond your front door as we uncover new perspectives, explore intriguing ideas, and have real conversations with the best guests. Ready for something different? Let's get started.
Well, it seems, Dr. McMillan, that sleep is taking center stage these days in conversations about health and wellness. It seems to be everywhere in the newspapers, online. Does sleep have an impact on overall health and wellness?
It absolutely does, Lauren. So not only do we feel fatigued if we're not getting the adequate quantity of sleep,
Right.
but we also need the right quality of sleep on a regular basis, right? And so we're not only fatigued, but as I mentioned, we have cognitive impairments. We have motor impairments. We're clumsier. We're likely to find ourselves in emergency getting stitches in a plaster cast.
Right.
We have cardiovascular disturbances, so our blood pressure increases. We see mood changes, both increases in anxiety and also heightened depression risk. And we have much poorer coping. So, a lot easier to feel overwhelmed and
Right.
not make good decisions. And we have a lot of changes in our hormones. One of them that's really important to our overall health and sort of the repair of our tissues and cells is growth hormone. So we associate growth hormone with children and growing, which certainly is true, and it's absolutely imperative for them. But we all need adequate amounts of growth hormone to help with this tissue repair. And we secrete almost all of our growth hormone while we're sleeping. So if you are regularly shortchanged on your sleep, the levels of growth hormone that are circulating for you are likely going to be insufficient. So that's another thing. And we don't regulate our blood sugar as well. It's almost like becoming a type 2 diabetic. And this can happen quite quickly. And you may be aware that as your blood sugar levels are not as well controlled, you are at greater risk of infection, right? So you really want to have a good control over that to make sure that you're healthy and that you stay healthy. Another thing that happens too when you're not well rested, and these can be both acute and chronic consequences of sleep disturbance, but you don't mount a immune challenge as rapidly. So when we're exposed to, viruses, our immune system kicks in, or bacteria too. It kicks in to sort of fight off these viruses, right? And when you are sleep deprived, you have a very slow response. Eventually it kicks in, but it's not nearly as robust. And so you're at risk for getting sicker than you ordinarily might be. While we always want to be healthy, these days we are particularly aware of our circulating viruses and things going around, whether it's influenza or COVID iterations, right? So we really need to try to put our best foot forward in terms of our health status. The other thing that happens is our circulation is not as impaired. Ordinarily, when we're sleeping during that slow wave sleep, we get a real wonderful perfusion of blood to our extremities. So our fingers and toes get extra sort of good perfusion of blood. That really is helpful for healthy tissue. And again, that is not happening as well when we're not getting enough sleep. And anyone who has a pain condition, whether that's a chronic, arthritis, that's these kind of things, or acute pain from, say, surgery or something like that, or an injury. What we also know, and I did quite a bit of work in this area when I was a doctoral student in Seattle, what we see is that you experience more pain for a given pain insult.
Oh, okay.
And so as a nurse and as a professor of nursing and working with my clinical colleagues, I really try to help them understand that supporting good sleep health in our patients and in our community is really, really critical to offering optimal pain management as well. If you're not getting good sleep, you're feeling more pain. If you're having more pain, it becomes vicious cycle because then you can't sleep as well. So lots of things that, the more we learn about sleep, the more critical it is in my mind that we really do our best to support that within ourselves and our family members and our community members as well.
So even if we're tracking a decent number of hours sleep, what exactly is quality sleep? How do we define that?
Well, if you're finding that you're waking up several times in the night, or your sleep is very light. In the sleep field, we call it sleep fragmentation, where you're maybe, sort of bouncing around quite frequently and often awakening in the night. Now, it's normal to waken briefly. In fact, we all probably do, and we probably don't even remember that we do, very briefly, and we fall back to sleep. But where you're waking up repeatedly, or sort of the depth of your sleep is not good, you're not getting all of the different kinds of sleep that you need. So we have two major sleep states: non-REM or non-rapid eye movement sleep. And that has 3 different stages within it: very light, stage 1, and sort of a deeper stage 2, and then slow wave sleep, or stage 3. And then we have the rapid eye movement sleep, or REM sleep, which is often associated with dreaming, although not exclusively. And we need both of those major sleep states to sort of help our brains, I think, reconfigure in a way, and to offer us the best outcome for our bodies physiologically. And the other thing I'll circle back to, and I meant to share, in terms of when we're challenged, whether we're flying across the ocean, or visiting, or doing time changes, our bodies are not just sleep and wake synchronized. We have this mechanism that helps to set our clock and all of our internal rhythms. It drives our hormones, body temperature, our levels of alertness. And so this sleep and wake rhythm, and especially the sort of the light, helps to entrain this rhythm. And it's almost like our bodies are like orchestra. When a symphony is playing, say, Beethoven's Fifth, the musicians come in and out at a certain time, right? They're playing the same piece. They're all playing Beethoven's Fifth, but they're not playing the exact same note at the same time. And when you are flipping from night shift to day shift, or you've just flown from Spain to Toronto, your symphony is a little muddled. And so all of this is not coming in at the same time. There's a lot of disruption, and you don't feel good. Like, you don't feel yourself, right? And so it takes a few days for this entrainment to align again. And so it's not just our sleep and wake that is entrained, but we have a circadian rhythm that is critically aligned with this biological clock called the suprachiasmatic nucleus. And so it's light that helps to entrain this little bundle of nuclei and helps to really get this rhythm and this body orchestra all tuned up and playing magnificently.
Wow. Well, I really like that analogy. It's a lot more complicated than most of us think. There's a lot more going on, which is really interesting to hear. So there are many products out there that claim to assist with the improvement of sleep, from melatonin to herbal remedies to prescription medication. Is there one recommendation you could make for our listeners to consider to improve the quality of their sleep? And if so, what would that be?
Exercise.
Exercise.
It would be exercise.
Simple as that.
It would be exercise, and outside as much as possible, but exercise, and at any time of the day. There's some wonderful guidelines on the Participation website Really recommend that you have a look at those. And they have guidelines for all the ages, from young children to older adults. And for the first time, they include sleep as one of those components within the participation guidelines. So really, really helpful. We used to think that, I shouldn't do exercise because it's too close to bedtime. It's not ideal, right? Because you don't want to sort of rev up your metabolism if possible. But if that's the only time you can exercise, you'll actually sleep better, more soundly, and the quality of your sleep will be better. The other thing that exercise does, and especially if you can sort of do it earlier in the day, if possible, is it helps you to feel a healthy tired. And so much of us, we've got a lot of things going on in our day. And I mean, we still have a lot of challenges, whether it's economic or family issues or whatever. And exercise can be a wonderful way to sort of reduce your stressors, sort of burn off a little bit of that stress and have almost like a timeout where you're not worrying so much about all of these things, right?
Well, I imagine so much more than having a couple glasses of wine, which a lot of people say, well, it sort of calms me down and it makes me sleepy. But you're not getting the good quality of sleep, correct?
No, actually, that's very true. So wine or alcohol can make you sleepy, but unfortunately, it disturbs your REM sleep. And it also is a diuretic. So after several hours, maybe you've gone to bed, but after several hours, you may need to get up to go to the bathroom. And then by then your homeostatic drive, which is sort of your sleep pressure to fall asleep and stay asleep, has reduced. And then you may find it hard to stay asleep. So everything in moderation, and certainly, cutting back on caffeine levels, getting those cell phones turned to silent. And I don't have a TV in my bedroom. I really try not to use my computer or laptop right before bed, because if you don't screen out that blue light, it suppresses melatonin. And melatonin is an endogenous hormone, so our body naturally secretes that. And it will help us to fall asleep and stay asleep in the early hours. If we expose ourselves to a lot of bright lights, and particularly the blue light spectrum, it suppresses that melatonin. And so we don't have that sort of normal feeling of feeling sleepy. We're still very much alert, and at least for a while. That's definitely a problem that I've been seeing in a lot of teenagers, but adults as well, is that we use technology and tablets way too close to bedtime, and we don't necessarily turn off or have the cell phones in a different room. And so we hear these noises and beeps and tweets and whatnot that are fragmenting our sleep.
Well, I think some people are using their tablets as a replacement for books. They think they're reading, they think it's making them tired, when actually the blue light is doing the opposite effect.
And you can get apps, or you can get film on top of your laptops or tablets and things like that. So there are ways to mitigate that, but to be aware. And when we are doing things that are, it's one thing to read on your like a book or something in a tablet format, but if we are really doing something that's very engaging or that's possibly stressful, right? I mean, looking at maybe the news or something that is very alarming, or we're engaged in looking at Facebook, and we seem to sort of get almost addicted to certain platforms, right? To look at. It's not allowing us just to sort of slow down. And we need both a calm body and a calm mind in order for our brains to sort of flip over the switch. And if we're doing something that's very engaging or anxiety provoking, our brain is really sort of, the neurons are flashing, right? And It's noisy and it doesn't allow you to fall asleep. Similarly, if you just run, I don't know, you were out running or you were playing hockey or something late, your blood pressure's high, your heart rate's high, respiratory rate's high. You won't fall asleep right away.
Good to know to be outside, get it done a little earlier on in the day so that your body has time to adjust.
Right.
Well, Dr. McMillan, I want to thank you very much for taking the time to chat with us today. I'm sure our listeners will be very grateful to put some of your tips into practice. And I think we'll all agree that here's to a good night's sleep.
Well, you're very welcome. I just hope that we can all take a pause and think about how important our sleep is. And, we're worth it. We're worth it to try to make that a priority. Because if we can get a good night's sleep, if we can support our families or community members to get better sleep, we will all function better. We'll learn better. We'll play safer. We'll think more effectively. And it makes for a great day. So thank you again.
Thank you for joining us at Home and Abroad with your host, Harrison Walker. You have been listening to an excerpt of a larger episode from Season 1. For the full episode, you can visit our website or browse our back catalog. If you enjoyed this episode, you would be a real gem if you would rate and review our show. It helps us to grow and expand our reach. You can also subscribe to follow us each week as we continue the conversation. Find us on Instagram at Harrison Walker or visit us at www.homeandabroadpodcast.com. We do have great merch, just saying. And of course, we would love to hear from you. And for you truly dedicated fans who have listened all the way to the end of this episode, we offer exclusive interviews, outtakes, challenges, and more on our paid channel, not even the cost of a latte once a month, depending, of course, on where you buy your coffee.